This is the most effective squat after age 50. Unfortunately, many people still believe that the natural decline in muscle mass that occurs with age is an irreversible process. What they don't know is that a single well-executed movement can change everything. With just a few minutes per day, you can recover leg strength, postural stability, and surprisingly, almost nobody talks about this exercise. Today, you'll learn everything about the sumo squat, a powerful variation of the traditional squat that has been specifically adapted so you can deeply strengthen your muscles while taking care of your joints. Stay attentive until the end, because we'll tell you all the benefits you'll gain by including this squat variation in your routine, and also everything about how to execute it correctly to avoid any chance of injury. Believe it, after a few weeks of practice, other people your age will notice significant changes in your posture, your strength, and your confidence. Let's start with the 7 specific benefits of the sumo squat for people over 50 years old. Benefit number 1, bone density stimulation. One of the most concerning aspects of aging is the progressive loss of bone density, which can lead to osteopenia and, eventually, osteoporosis. These conditions make bones more fragile and susceptible to fractures. The sumo squat, being a weight-bearing exercise, acts directly on bone strengthening. When we perform exercises where our bones need to support weight, a mechanical stimulus occurs that activates cells called osteoblasts, responsible for forming new bone tissue. This process, known as bone remodeling, is crucial for maintaining the structural integrity of bones. Studies show that exercises like squatting can increase bone mineral density by 1 to 3% per year, which represents a powerful defense against age-related bone loss. For people over 50 years old, this benefit is invaluable, as osteoporosis affects approximately 1 in 3 women and 1 in 5 men above 50 years of age. Benefit 2, natural hormonal stimulation. One of the least discussed but extremely important aspects of aging is the natural decline in the production of anabolic hormones, such as testosterone and growth hormone known as GH. These hormones are fundamental for maintaining muscle mass, energy, and even mental clarity. The sumo squat, by involving large muscle groups working simultaneously, functions as a powerful stimulus for the production of these hormones. When you perform compound movements that require significant effort, your body responds by releasing a hormonal cascade that includes testosterone, GH, and other anabolic hormones. Research shows that people over 50 years old who practice strength exercises like squatting can experience increases of 15 to 20% in testosterone and GH levels. These increases, although temporary, have cumulative effects when the exercise is practiced regularly. Benefit 3, improved hip mobility and flexibility. The wider foot position in the sumo squat requires external rotation of the hips that naturally works on the mobility of this joint. This is an area that frequently becomes rigid over time, limiting our movement capacity. The hip joint is one of the most important in the human body, as it connects the trunk to the legs and is fundamental for practically all movements we perform while standing or walking. When hip mobility is compromised, we compensate with inadequate movements that can overload the lumbar spine or the knees. By practicing the sumo squat regularly, you are actively working to maintain and improve the range of motion of this critical joint. Benefit 4, strengthening lower limb muscles. As we just mentioned while discussing the hormonal issue, the sumo squat is exceptional for strengthening multiple muscle groups simultaneously. It intensely activates the glutes, adductors, quadriceps, and hamstrings, creating a global strengthening effect on the lower limbs. The glutes, in particular, are activated very efficiently in this exercise due to the external rotation of the hips. These muscles are fundamental not only for body aesthetics, but mainly for pelvic and lumbar stability, besides being the main propellers of the body when walking and climbing stairs. Did you know that the gluteus maximus is the largest muscle in the human body? Indeed it is. The adductors, located on the inner thigh, are muscles frequently neglected in conventional exercise programs and end up being intensely worked in the sumo squat. They are essential for lateral stability of the hip and knee, reducing the risk of falls. The quadriceps, on the front of the thigh, are obviously fundamental for any type of squat, but in the sumo squat they work in synergy with other muscle groups, which helps prevent common muscle imbalances. The hamstrings, on the back of the thigh, are also significantly activated, especially in the rising phase of the movement. The balanced strengthening of these muscles helps prevent knee and lower back problems. By strengthening these large muscle groups with the sumo squat, you are directly combating this natural decline, maintaining strength, functional independence, and the ability to perform daily activities without assistance. Before we continue to Benefit 5, don't forget to subscribe to the channel. Having constant access to correct and science-based information is what will make you progress in the long term in the world of bodybuilding. Benefit 5. Strengthening the lower back and core. The sumo squat requires an upright trunk posture and constant activation of the core muscles to maintain stability during the movement. This results in significant strengthening of the abdominal, lumbar, and spine-stabilizing muscles. The lumbar region is particularly vulnerable as age advances. Statistics show that approximately 80% of people will experience lower back pain at some point in life, with incidence increasing significantly after 50 years of age. By strengthening the muscles that support the spine, the sumo squat helps create a natural muscle vest that protects the spine structures, reducing the risk of injuries and alleviating existing pain. The core muscles, which include not only the abdomen, but also the deep muscles of the spine, obliques, and transverse abdominis, are fundamental for almost all movements we perform. They form the basis of our postural stability and are essential for transferring force between the upper and lower body. This core strengthening also has benefits that go beyond the spine. A strong core improves balance, facilitates deep breathing, and even assists in basic functions such as coughing and sneezing effectively. Benefit 6. Improved balance and coordination. Balance is a complex skill that depends on the integration between the visual, vestibular, inner ear, and proprioceptive systems, sensors in muscles and joints. As age advances, all these systems tend to deteriorate, resulting in a dramatic increase in the risk of falls. The statistics are alarming. 1 in 4 elderly individuals above 65 years suffers a fall each year, and falls are the leading cause of fatal and non-fatal injuries among elderly people. The sumo squat is exceptionally effective for improving balance, as it requires awareness of body position in space and refined postural control. The wide base created by foot positioning challenges the body's balance systems, forcing them to adapt and improve. By regularly practicing the sumo squat, you are essentially training your brain and muscles to work together more efficiently, improving your ability to react quickly to balance disturbances, such as tripping on a rug or stepping on an irregular surface. Benefit 7. Body aesthetics. Although functional and health benefits are priorities, we cannot ignore the positive impact that the sumo squat has on body aesthetics. This exercise is particularly effective for toning the gluteal region and inner thighs, areas that tend to lose tone as age advances. The glutes, when well developed, support the lumbar region and create a more youthful and athletic silhouette. The toning of the inner thighs, frequently neglected in conventional exercise programs, contributes to a firmer and more harmonious appearance of the legs as a whole. This improvement in body composition is not just a matter of vanity. Psychological studies show a direct correlation between body image and self-esteem, especially in older adults. When we feel good about our physical appearance, we tend to be more confident, socially active, and motivated to maintain other healthy habits. For these factors, it's not uncommon for regular practitioners of the sumo squat to report that friends and family notice changes in their posture, the firmness of their legs and glutes, and they're more confident and upright walking. Now that you have more than enough reasons to start putting the sumo squat into practice, let's go through the step-by-step of how to execute it. How to execute the sumo squat. Begin with your feet much wider apart than shoulder width, approximately 1.5 to 2 times this width. The toes should be pointed outward, forming an angle of approximately 45 degrees. Keep your spine in a neutral position, with chest lifted and shoulders relaxed and back. You can keep your hands in front of your body, as if holding an imaginary steering wheel, or you can extend them in front of you to help with balance. Start the movement by pushing your hips backward and bending your knees simultaneously. Imagine that you are trying to sit in a chair, positioned right behind you. Your knees should move in the same direction that your feet are pointing, staying aligned with the second and third toes. Descend to where it's comfortable for you, ideally until your thighs are parallel to the floor or even a little below, if your mobility allows. At the lowest point of the movement, verify that your knees are aligned with your feet and not collapsing inward, and that your spine remains in a neutral position, without rounding. To rise, push the floor with your feet, strongly contracting the glutes and quadriceps. Imagine that you are tearing the floor with your feet, trying to push one half of the ground away from the other. Inhale deeply as you descend and exhale forcefully as you rise. Return to the starting position, but without completely locking the knees. Maintain a slight bend in the knees between repetitions to keep tension in the worked muscles. There are 7 errors you need to avoid. Error 1. Allowing the knees to collapse inward. This is perhaps the most common and potentially most harmful error. The knees should always follow the same direction as the feet. If your knees tend to fall inward during the movement, this may indicate weakness in the hip abductor muscles or lack of body awareness. Start with less deep squats and focus on maintaining proper alignment. Error 2. Lifting the heels off the floor. Your feet should remain completely supported on the floor throughout the entire movement. If the heels tend to lift, this may indicate limitations in ankle or hip mobility. Consider using a small support under the heels temporarily while working on your mobility. Error 3. Rounding the back. The spine should remain in a neutral position throughout the entire exercise. Excessive rounding, especially in the lumbar region, can lead to injuries. If you notice that your lower back tends to curve at the lowest point of the squat, this is a sign not to go down as far until your mobility and strength improve. Error 4. Excessively tilting the trunk forward. Unlike the traditional squat, in the sumo squat, the trunk should remain more upright. Excessive trunk inclination transfers tension to the back instead of the leg and glute muscles. Error 5. Misalignment between knees and feet. The knees should be aligned with the second and third toes of the feet throughout the movement. Knees that move outside the line of the feet can cause inadequate tension in the joints. Error 6. Looking down. Keeping your gaze fixed on a point ahead helps maintain the spine correctly aligned. Looking down tends to make the chin fall to the chest, which can misalign the cervical spine and compromise the entire movement. Error 7. Holding your breath. It's common for some practitioners to hold their breath during effort, which can dangerously increase blood pressure. Maintain a conscious and controlled breathing pattern. How many repetitions and sets to do? The ideal number of repetitions and weekly frequency of the sumo squat depends on your current level of physical conditioning, but here are some general guidelines that can be adapted to your specific situation. For people who are beginning to practice exercises or returning after a long period of inactivity, try starting with 2 to 3 sets of 8 to 10 repetitions. Practice 2 to 3 times per week, with at least 1 rest day between sessions. Focus on movement quality rather than quantity and use only body weight initially, without adding external loads. For intermediate practitioners who have been regularly practicing exercises for at least a few months, progress to 3 to 4 sets of 10 to 12 repetitions, practicing 3 times per week. Consider adding light resistance, such as light dumbbells held in the hands or a light bar on the shoulders, if the movement with body weight becomes too easy. For advanced individuals with good physical condition who have been regularly practicing exercises for more than 6 months, perform 4 sets of 12 to 15 repetitions, practicing 3 times per week, and always try to use additional resistance as appropriate for your strength level. Remember that progression should be gradual and always respecting your body's signals. It's better to do fewer repetitions with perfect technique than more repetitions with compromised form. Don't be alarmed. It's normal to feel mild muscle discomfort 24 to 48 hours after exercise. If you feel more acute pain or pain that persists for longer, this may indicate that you are overexerting yourself or using inadequate technique. For people above 60 years old or with pre-existing joint conditions, it's recommended to start with even lighter sets, perhaps only 5 to 8 repetitions, and focus on establishing the correct movement pattern before increasing the load or volume. How to adapt to continue progressing. To continue obtaining benefits from the sumo squat as you get stronger, it's important to implement appropriate progressions. To adapt the exercise and ensure that you continue progressing, we can use 6 basic strategies. Number 1. Gradual increase in the number of repetitions. Start by adding 1 or 2 repetitions to each set when the current number becomes comfortable. For example, if you are doing 3 sets of 10 repetitions without difficulty, try 3 sets of 12 in the next session. Number 2. Increase time under tension. Deliberately slow down the movement, especially in the eccentric phase. For example, take 4 seconds to descend, and then rise in 2 seconds. This increases intensity without the need to add weight. Number 3. Addition of a pause at the lowest point. Remaining at the lowest point of the squat for 2 to 3 seconds before rising significantly increases the difficulty and muscle recruitment. Number 4. Introduction of external resistance. When the body weight squat becomes easy, you can gradually add resistance by holding light dumbbells in your hands, using kettlebells secured close to your chest, or using a light bar on your shoulders. Always remember that any type of progression should be gradual and individualized. Listen to your body, and advance only when you feel completely comfortable with the current level. For people over 50 years old, it's particularly important to prioritize movement quality and joint safety over constantly increasing intensity. Advanced muscle preparation tips. Before performing the sumo squat, it's beneficial to adequately prepare your muscles and joints. Proper preparation not only reduces the risk of injuries, but also improves the quality and efficiency of your training. Start with 5 to 10 minutes of light cardiovascular activity, such as walking in place or stepping up and down a low step, to increase body temperature and blood flow to the muscles. Next, dedicate a few minutes to mobilize the joints that will be most demanded in the sumo squat: ankles, knees, hips, and lumbar spine. Gentle ankle rotations, knee circles, hip rotations, and stretches can help prepare these areas. And if you want to discover 6 specific stretches that, besides preparing your muscles for the sumo squat, can also help reverse years of damage and negligence to the body, we're showing right now on the screen a video demonstrating and better explaining each one of them. Don't miss it. Thank you for watching this far, and may God bless you, my friend.